Kathina. I'm from Mombasa, and I'm here on behalf of Nuliana Muluki, my daughter. When Nuliana was 5 years old, that is last year, 2024, she started having frequent infections. And once we were done with the antibiotics, her infections would come back. Also, she started losing weight quite fast. And yeah, she was playful before. She started a little bit not being so playful, weak a little bit, and then also some mild joint pains. We were first admitted at Coast General, where the disease was not, we were not given any diagnosis. Then we moved to a private hospital. That's when we were partially, I would say partially diagnosed. And then we were referred to Kenyatta National Hospital, awaiting a specific test that was sent to Aga Khan. So when we came to Kenyatta, the diagnosis was not clear, but at least we knew her blood had issues, or her bone marrow was somehow compromised. She was diagnosed with ALL, which is leukemia. So that is last year in March.
My name is Godri Chariton Wadu. I'm a clinical officer by profession, currently working in pediatric hematology and oncology unit. I've worked in that unit for the last 5 years, and that unit basically entails treatment and care of children diagnosed with childhood malignancies. First and foremost, we got in contact with Nuliana Muluki, who is a 5-year-old girl. Last year, March, she came in as a referral from Pandya Hospital in Mombasa, and by then we had gotten in touch with the healthcare providers in that institution prior to the child coming to institution. And the symptoms that the child came with was actually bleeding tendencies, and that one you're talking about nose bleeding and gum bleeding. Had bone pains, and generally the joint pains within the extremities. They also came with loss of body weight and loss of appetite, and less activity in terms of physical activeness. The child plays less and actually interfered with the normal daily routine of the child, for example, going to school. So all that got disrupted, which actually prompted the parents to take the child to the hospital, and eventually leading to the child being referred to our institution. So basically in symptomatology, that is what the child had.
At first, when we came to Kenyatta, we were admitted at 3C before the clear diagnosis. Then now when the results came for flow cytometry, which was sent to Aga Khan, we were referred now to 3D, where it's a pediatric oncology ward. Then from there we started the treatment. We started the first dose of chemotherapy, which was in the induction, which lasted around 6 weeks. And then we were sent home for 2-3 weeks. And then now we started coming for clinic, the consequent phases of treatment. And late last year, we entered the last phase of treatment, which is called long-term maintenance, where we only come for treatment once a month.
Yeah, so specifically for Nuliana, we're talking about acute lymphoblastic leukemia, and the risk stratification you're referring to here is a standard risk. So basically for acute lymphoblastic leukemia, the treatment modality here is chemotherapy. And the goodness with acute lymphoblastic leukemia is that the goal of care is always to cure, and it is very possible to cure. So the treatment modality is chemotherapy, which goes about 2 years and 6 months. The first 6 months, usually life is disrupted because most of the time they're in and out of hospitals, and we are glad that she's past that period. So the remaining 2 years is usually 1 year visit, and I can confidently say that you're progressing well. and she's responded very well to, especially at the first stage of treatment, which is induction, which we are able to confirm by a repeat bone marrow that we actually did, and it confirmed that the disease is actually in remission from the acute lymphoblastic leukemia itself. So right now we are basically maintaining the remission, and remission, by remission what I mean is the achievement that we managed to get, and the achievement is the good response that we got from our treatment. So whatever it is she's getting right now is basically a maintenance of that achievement with the aim of completely eradicating it towards the end, as we aim for completion of treatment and complete sustaining of remission status. Yeah.
When we got diagnosed, the first thing that I remember, I was completely broken into pieces. The word cancer, most of the time we know the myth out there, it's a death sentence. So one thing I can thank KNH for, I was given counselors to counsel me, to take me through the journey even before we started treatment. So that was very helpful. And then when we started treatment, the nurses were there. When my daughter, maybe she's vomiting because of the side effects of chemo, they have to test every morning, maybe the blood sugar levels. They were there. The temperature, if she has a slight fever, they will take care of that. And the doctors throughout the journey, they've been very helpful. Like I said, I come from Mombasa. Getting treatment from Mombasa all the way to Kenyatta is not easy, but they are always a phone call away. I can call in case my child has any issue, even fever, and they will prescribe. And in short, they've just been with me, supported me throughout the journey.